This series is going to be discussing topics within substance use disorder, such as addiction, overdose, and recovery. These discussions may be sensitive or distressing for some listeners, particularly those with personal or professional experiences in this area. Listener discretion is advised.
Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Welcome. Thank you for taking the time to join us for this podcast series on treating substance use disorder. I'm Dr. Candace Pierce with Elite Learning by Colibri Healthcare, and you are listening to our Elite Learning podcast, where we share the most up-to-date education for healthcare professionals. In this series, I have Brooke Schaefer joining me, and I'm really looking forward to this discussion with you, Brooke, not just because of your expertise that you bring to this topic, but because of that passion and that energy that drives you for this particular topic.
Thank you so much. I'm so glad to be here.
Yes, thank you for joining me. I also want to say thank you for all that you do to work for and to bring awareness to substance use disorder and patients who are affected by substance use disorder. And before we really jump into what is substance use disorder, I wanted to kind of talk about some of the latest statistics to really help us grasp the gravity of what it looks like for our country. I think it's really hard today to find someone who has not been affected by substance use.
Yeah, most definitely. It's definitely gone away from being other people's problem to everyone's problem.
Right.
And there's different degrees of severity, right? But it really does impact, almost everyone.
And it does, from not just the addiction itself, but you also look at the disabilities that it causes and even the death and the grief that they have to live with.
Right.
And I know we've been hearing about substance use disorder, unfortunately, for what seems like years now. And I think over time, a lot of our topics in healthcare really become more like white noise. After a while, you stop hearing about it. COVID became white noise. And I just kind of wonder if the difference here is that substance use is not really getting better. So I pulled some statistics. So I'm going to share some statistics. A lot of the 2024 sources were actually quoting still 2020 statistics. So I had to do a lot of digging, but I found some from 2023. All right, you ready?
Yes.
Feel free to interrupt me at all. I'm just going to kind of go through these if you want to add some information to this, because at the end, I'm going to ask you what your thoughts are.
Excellent.
Okay, around 48.5 million people battled a substance use disorder in the past year. That's 16.7% of the population. 10.2% had an alcohol use disorder. 7.5 million people struggled with alcohol and drug use disorder simultaneously. 20.4 million suffered from both a mental health disorder and a substance use disorder. Yeah. And there's one that really bothered me a lot because, these all bother me, but I'm a parent and my kids have not yet graduated high school yet. So this one really bothered me because I felt more connected to this one.
I know this one.
You know this one? You know where I'm going.
Yeah.
47% of young people use an illegal drug by the time they graduate high school. These are some staggering statistics. What are your thoughts?
Well, we also know that the younger that people are when they start using substances, oftentimes the bigger impact it has. And so that the brain is not done developing until we're in our mid-20s. Roughly 25, but that even varies a bit from person to person, right? We don't all on our 25th birthday automatically reach brain
It's
maturity.
all here. Look, my brain's done.
Now I got it all figured out. I'm bigger than 25,
Yes.
And so the younger people are when this impacts them, the more significant that impact can be. And I will tell you that with the clients that I serve, I primarily serve women, pregnant and parenting women in the substance use disorder world. But I also serve other clients, and when I'm doing their intake appointments, many of them will talk about their first substance use exposure being at 12.
Wow.
Yeah.
I didn't even, my parents drank alcohol every once in a while. I remember as a child, my dad, he did a dip. They use the Coke can and you
Yep.
thought it was Coke and it was not Coke. Like I did that once and I still today do not drink out of a Coke can. But other than that, like I didn't see a lot of the drugs growing up. And I
Right.
grew up in a small town. I really
But
didn't see them till high school.
seeing them is one of the big indicators of what happens later in life. And so there's so
Mm-hmm.
many factors that go into what leads to substance use disorder. But part of that is seeing it as normal within the culture that you live in. So
Mm-hmm.
if you're seeing your parents use substances, your big sister use substances, your cousins, your grandma, like there's way more likely that becomes more normalized to you.
Right.
And then those risk factors increase even more.
Right. And your peers, you see your peers
Oh, yeah.
start going home and taking stuff out of their parents' cabinets and bringing it to school. And, I'd heard those stories, but I never saw it. Um, my brother was 5 years older than me. So a lot of those things, like they closed campus. Like, no, I'm just now getting to high school and you closed the campus. I can't go get lunch, but that was part of the reason why they closed campus is
Right.
because, kids were going home and bringing stuff back that they should not have brought back. But okay, so what is substance use disorder and how is it defined clinically?
Yes, this is really tricky because there's two key factors that you really have to think about here. The difference between addiction and dependency are really
Hmm.
important because they're not the same thing. So you could very much be addicted to something like your phone. If the
Yeah,
first thing you do is wake up in the morning and check your phone, like before you get out of your bed, before your feet touch the ground, if you check your phone, you need to
yeah.
check in with where your phone sits in your heart from an
Hmm.
addiction standpoint.
Well,
Are
you
you
watch people with their phone and like they'll set it down, and what is it, 5 seconds later, they're like, and they don't even look at anything, and then they pick
it,
it back up.
it's
And
designed to please us, right? It
yeah,
hits those dopamine receptors. Look at my likes on Facebook, and
yeah.
then it really hits those dopamine receptors and you like it. Even
Hmm.
subconsciously, you like it. And so those moments are really important about thinking about this concept of addiction. Um, Really, we define addiction as the use of substances regardless of harm and consequences. It could
Hmm.
also be things beyond substances. People can be addicted to sex. People can be addicted to the internet, gambling. There's all sorts of things. But addiction itself, it requires you to have that concept of use beyond the ramifications, regardless of harm and consequences. But then also there's the concept of dependency. And
Yeah.
dependency is a physical need. There's tolerance potential, there's withdrawal potential, and you could have both.
Hmm.
Definitely, if you are struggling with fentanyl use disorder, you are physically dependent on that fentanyl, and you
Hmm.
are also addicted to that fentanyl. You could be being prescribed pain pills from your doctor that you're taking exactly as prescribed. That would mean that you're not addicted to them, but you are dependent upon them. And so it's really important to understand this addiction versus dependency. You can be both things at the same time. You can be one thing at the same time. If you're
Hmm.
only dependent, you do not have a substance use disorder. So I'll get clients sent to me where they say, okay, she has a chronic pain disorder. She's been on opiates for 3 years, but she takes them exactly as prescribed from her doctor. She doesn't have a substance use disorder.
Right.
So it's really important we understand that because substance use disorders, the definition of them clinically is really careful between, you'll see overlap where people try to make dependency be addiction. It's not the same thing. They're separate from each other and they
So I'm
can
going to
go
go
hand in
back
hand.
to your story where, you were just saying she is prescribed opioids because she has a pain disorder. She takes them correctly. So she has a dependency on them. Can that then turn into an addiction?
Oh, absolutely. And that's the one as a mother of,
Hmm.
my kids range from 26 to 12. So I've been
Oh,
through a couple of these wheelhouse. I have 4 kids that range significantly in age,
yes.
but you'll see a lot of the clients I serve, when they first start coming to me, I'll say, what was your first experience with opiates? And many of them say it was when they had their wisdom teeth taken out.
Oh, yeah.
They were prescribed an opiate and they said, I loved it. The first time I took it, I never felt anything better in my life.
Mm.
And, that was the starting point for this. And that's where we have to be really careful as provide. So I myself am a nurse practitioner and I have to be very careful about prescribing narcotics in a way that explains to people, hey, you had this major surgery. This is appropriate use of this medicine. But if you take it and you really, really like it, we need to
Hmm.
reevaluate that. And these are clients who don't have substance use disorders. It's important conversations. If you took an opiate pill and you feel the best you've ever felt in your life, that's
Yeah.
very tricky and a very big indicator of long-term use problems.
So there's something I've always heard. It was mainly around alcohol. And it was, if you could take one drink and become addicted because of the way that it makes you feel. So like what you were saying, I took an opioid and I just loved the way it made me feel. Are there some people that just are more likely to become addicted to something? Because
Absolutely.
I don't know how to ask the question I'm trying to ask, but
yeah, I think what you're getting at is, what are the factors that make someone more susceptible to substance use disorders?
yes.
Okay. So definitely a history of trauma is one of the biggest indicators. So I don't know if you've heard of ACE scores, but I'll summarize them real quickly for listeners. An ACE score is adverse childhood experiences, and it has to do with things that happened to you prior to being 18 years old that were completely beyond your control. If you get online, you can look up quizzes where you go in and enter your own information. Okay. Were your
Yes.
parents divorced? Okay. That's one point. Did you grow up in a house where someone was incarcerated? That's another point. Did you see your mother physically abused? Another point. Or was there violence in the house? And were you neglected, abused, sexually? There's 10 different points possible. The higher your score, the more statistically likely it is that you will have a substance use disorder. And it's linked very closely to things that happened to people as children that had nothing to do with them. You don't pick what family raises you. You don't pick where you were born. And a lot of how if you experience extreme childhood trauma, your risk factors for many things go through the roof. And that's really important part of us making sure that it's treating substance use disorder is also ensuring that kids are not experiencing extreme trauma.
Right. And
'Cause they link
genetics?
to each other.
Genetics play
Definitely.
in there?
There's definitely a genetic link. So it's somewhere between 40 to 60%. This is National Institute on Drug Abuse. Talks about how there's about a 40 to 60% chance of your risk if you have a parent who struggled with substance use disorder goes up about 40 to 60%. And so that's an important conversation too. You got to say to your kids, hey, grandpa was an alcoholic. We got to be careful with this. You may not be the kind of person who can recreationally drink alcohol.
Right.
And you got to be realistic about that. It just may not be something you can do. And that's really clear conversations about that. But then, there's also the mental health disorders are so strongly linked to substance use disorder. These co-occurring issues that really have a big link to how predispositioned you are for substance use disorder. Yeah.
Right.
Multifaceted.
Yeah, it really is. It's hard to really look at the risk, to determine the risk. There's so many pieces that play into this puzzle to determine if this is the track that we're going to end up on.
Yeah. And we're humans. We're complicated, right? I mean, no one is as simple as just, this is how this works for me. It works for everyone like this.
Right.
That's one of the really big things we have to be careful with in treating people with substance use disorders, is this one size fits all concept is a terrible idea and does not help clients. It is not the way that we serve our patients.
Right.
Because it makes it, you do it my way or you get out, but your way might not work for them. So we got to have a lot of different ways. There's lots of paths to recovery.
Yes. Just like there's lots of paths to raise your children.
Exactly.
There's lots of paths to recovery. Now, when we hear the term substance use disorder, you also hear the term alcohol use disorder. You used another term earlier in our conversation where you said fentanyl. Can all of these be used interchangeably? Is substance use disorder like that umbrella term? Is there like an official definition of substance?
Yes.
And what about nicotine vaping? Does it fall there?
No, nicotine use disorder, 100%. I diagnose people with it all the time.
There's another one.
And there may very possibly, like I've had clients where I'm diagnosing them with a nicotine use disorder, alcohol use disorder, opiate use disorder, benzo use disorder. Like, they've got this whole list of things that they are struggling with use. And so you can say they have a substance use disorder. That is an umbrella term that covers all the types of substance use disorders. So it's not wrong to say substance use disorder.
Hmm.
It would be wrong to say alcohol use disorder if they have a opiate use disorder.
True.
So
Yeah.
that's where substance use disorder covers everything. If you know specifically what substances you're dealing with, then you can use the substance name as part of the disorder
Okay.
diagnosis. Yeah.
Yes. How often do you see kids coming in with nicotine use disorder? Just out of curiosity.
I primarily treat clients who have severe substance use disorder. So if you came in
Yeah.
with only nicotine to see me, I would be delighted. Like, because I'm dealing with people who are, I'm like, nicotine, okay, like
Yeah,
we
we
can
can
figure that
handle
out.
that.
Right.
Yes.
And we joke about that, but really the nicotine disorders are significant long-term impacts and have huge effects on our
Hmm.
healthcare system and how people, especially the vaping is so new, we don't even really totally know, but we know it's not good. And so, we're getting data about that now, but
Hmm.
it's tough because the vapes are so unregulated
Hmm.
that I'm always like warning my teenagers, like, you guys, the vapes are bad stuff. You don't know what's in them. You don't know
Yeah.
how much concentration is in them. Like, this is bad stuff. Don't play with this. And, it's really, the vapes are not the safe version of smoking that we thought they were when they first got marketed, when they first came out.
Right. And we're seeing more and more youth using vapes.
Oh, absolutely. And
And
they're
I just,
marketed towards kids. I
oh,
mean, when you
yeah.
go in a gas station, they put them on a level where the kids can see them. They're bright, colorful,
How
like
to hide
cereal
them.
boxes.
Hmm.
Yeah,
How to hide
yeah,
them. Oh, you can buy this one. Nobody will ever know it. It looks like a pen. Or,
right.
but I think that we are going to see and are going to continue to see a rise in nicotine use
Oh, yeah.
disorder because of the unregulation and
Yeah.
the push for vapes.
Well, the products are smarter and faster than the regulations.
Yeah. And the
So when they cut
evidence.
one down, they just stop making it and start making a new one, and then it's out.
Hmm.
So, yeah, they're bad
That's
news. They're definitely bad news. Now, they're not killing people immediately like opiate use disorder is.
right.
And so the concept of one pill kills um, is is a is a policy that, or is a program they've been working on about, that right now with fentanyl. Fentanyl is
Hmm.
primarily the opiate that's on the streets right now.
Hmm.
And fentanyl, it's not fentanyl like, you know, the fentanyl patch that your grandma may have had when she was in hospice. Like, it's a different kind of fentanyl. It's much stronger. It's much higher concentrate. It's not hospital grade, pharmacological
Hmm.
grade fentanyl. It's very different and it's way stronger. And this fentanyl is being made synthetically and brought into the United States and sold. And it is being, because of 3D printers, people can create pill presses to make
Hmm.
these pressed pills that are made out of fentanyl powder that look like Adderall, that look like roxycodone, that look like a pill that you would sell to somebody and say, hey, this is not fentanyl. This is a pill. You know exactly what you're getting. This is a safer use option.
Hmm.
And people buy them and they're pressed pills. And so you'll get kids, younger people, teenagers, college kids, who will be buying what they think is an Adderall and it's a fentanyl pill and it'll
Oh my
kill them.
gosh.
I mean, the dose is so high
Yes.
that a single pill with no tolerance is absolutely a deadly exposure.
Seems
And
like
so that's something
murder.
we got to be really careful with kids. And that's
Yeah.
part of why you should always carry Narcan. I mean,
Hmm.
opiate overdose is reversible. And so if you get a dose of Narcan, if you overdose on an opiate and your heart stops beating and you stop breathing, you get a dose of Narcan, you will start breathing again. Your heart will start beating again. Especially if done quickly.
Hmm.
And so, in my household, for example, we're talking about our kids, if you're 12 years old or older, you carry Narcan because you never know when you're going to be at a gas station and the person at the pump next to you is going to overdose. I mean, it's all over the place, and we need to be ready to Narcan people because that's how we save lives. And then
Hmm.
people find recovery. And I'm a big believer that if you have to be Narcan 13 times in your life, and that's how many it took for you to find recovery, then that's how many it took. I mean, we need to treat people as often as it takes for them to
Hmm.
find recovery. The only time you can't find recovery is if you're dead. And so we need to keep treating people because you'll see stories all the time of people who were at the lowest of the low for a very long time. But then something finally happened where they were ready.
Something clicks, and
Something clicks, and they met the right providers and the right point in their life, and they got better.
right.
Yeah.
So earlier you did mention, mental health disorders usually accompany substance use disorders. Yeah. Which usually comes first? Do we really even know which comes first?
Yeah. And that's really hard to pull out all those apart, right?
Mm-hmm.
Because oftentimes you'll see that people who have anxiety, depression, post-traumatic stress disorder, PTSD, ADHD, you'll see these people have much higher rates of substance use disorder. People who have bipolar disorders or personality disorders also have much higher risks of substance use disorders. And but did it happen first or did it happen after? And that's tricky to say. I'll have clients report to me, I started using these substances because it made me
Mm-hmm.
feel significantly braver or less afraid or calmer or able to focus or any of these self-medicating type behaviors. But certainly when we see these comorbidity of
Such a hard
um,
word.
yes, comorbidity of different, substance use disorder plus a mental
Mm-hmm.
health disorder. I mean, that's extremely common. You'll see about 41% of individuals with post-traumatic stress disorder end up with a substance use disorder at some point.
Yeah.
And we see a lot of alcoholism, especially for people who have a history of PTSD. And
Mm-hmm.
it's serious stuff and it majorly affects the people around them, obviously.
You see it a
Huge
lot too
impacts.
with veterans,
Right.
unfortunately. You see a lot of
Right.
alcohol with veterans.
Yeah,
Um,
most definitely.
so we've talked a lot about some of the common substances that we see, fentanyl, alcohol, but also, do the ADHD drugs fit into substance use disorders?
If you're misusing them. So if your doctor's prescribing this medication and you're taking it as prescribed, then no,
Mm-hmm.
does not count as a substance
But
use disorder.
we see a lot of college students who are like, I'm going to go buy some.
Right.
Not at the pharmacy,
Right. Which is not legal.
right?
And if they're using it regardless of harm and consequences, that
Mm-hmm.
counts as addiction. And so that can get a little squirrely sometimes when you get somebody who's like, I bought one Adderall from my friend who has a script and I know it's a real script. I used it once because for whatever reason, whatever recreational reason,
Mm-hmm.
and it's just once in a lifetime thing. I'm
For
done.
finals week.
That's the one I hear a lot.
Yeah.
And that's not addiction necessarily. Now, if you know that you're snorting it and you're taking 5 pills a day and you're buying it from illicit sources, you got a problem at that point. Then you're
Yes.
using it regardless of harm and consequences. And that's when things start to escalate. Oftentimes people get started with a legal or at least a pharmacological grade substance
Mm-hmm.
like Adderall and then transition to methamphetamine. So not
Yeah.
everybody that ever recreationally uses Adderall will try methamphetamine. But oftentimes people who are using methamphetamine started with something else first. They didn't
Mm-hmm.
just start right with methamphetamine.
That's a big jump right
Yeah,
there,
it
for
is.
sure.
And
So go ahead.
I was just going to say, one of the things we don't talk about a lot is the misuse of caffeine.
I
I mean,
actually wanted to ask you about that, but I
yeah,
thought you might think that I am silly about asking you about caffeine because,
no,
it's caffeine. But you see all of these drinks out there and they just seem very unregulated.
they
Um,
are.
Even restaurants, restaurant chains having, young people are being affected hard. So, yes, I am so curious about caffeine.
Yeah, definitely. The most widely abused stimulant is
Mm-hmm.
caffeine. And especially in our culture, it's almost considered kind of funny. Like, oh my gosh,
Yeah.
they drink so much caffeine. Oh, she could float a battleship in the amount of
She
coffee she
had
drinks,
10
kind of
cups of
thing.
coffee this morning.
I drank 2 whole pots and people are like laughing, right? And I'm like, I
Uh,
mean, I do like to make a coffee run every now and then. I am not caffeine free.
yes,
But if you
I'm not
cannot
either.
function in your life without caffeine, well,
Hmm.
that's the use of caffeine regardless of harm and consequences. And that's where you got to think about, crap, I'm addicted to this stuff.
Yeah.
You can, and you're definitely going to withdraw from it as well.
Yes.
So,
So there's that dependency versus addiction, because my
you got
husband, for
both.
some reason, stopped drinking coffee. He drinks coffee every morning. He just stopped drinking it. I don't know why he stopped drinking it. He just decided to stop drinking it. And after a couple of days, he was having some severe headaches. And
Right.
it took him a while to be like, you know what? I think this is caffeine. I haven't been
Yep.
drinking my coffee.
Yep. Yep. And I mean, people don't die from
They
caffeine withdrawal,
can. Oh, well.
and they don't die from, and they usually don't have to be, put into any kind of special placement, recovery unit or program for caffeine recovery. But
Should they,
you
though?
certainly can overdose on caffeine. I mean,
Yes.
there are definitely cases. They're not as big as what we see with, like, there's not as many people, but we do have to be careful with these things. I mean, alcohol is a legal substance. You can buy that legally. It
Mm-hmm.
absolutely can kill you. That doesn't mean it's safe, and the caffeine is the same. It definitely can harm you in high doses. And so
Absolutely.
anything that is a recreational substance use must be done in moderation or it's an issue.
Yes.
So I had a friend who was a recovering alcoholic, and she said to me, I said, "Oh, I just want a cocktail at this place." And she said something like, "Do you have to have a cocktail to have fun?"
Mm-hmm.
I thought, well, now that's an interesting concept, right? Like, no, I
It
don't have
is.
to have one to have fun, right? And that's
Yeah.
just something that you got to think about. But the
So,
real high levels of deaths that we're seeing right now in the United States are related to the opiate use disorders and
still,
primarily fentanyl.
yeah, still
Yeah.
today. Started with the pills, and now we're up to the fentanyl.
Yeah.
So if I am looking at a patient, how can I really identify signs and symptoms of substance use disorder?
It's tricky because you certainly cannot look at people and say, you look like you have a substance use disorder
You've
and
been
always
drinking a
be
lot of
right.
alcohol.
Right. Right.
Uh-huh.
And so the real question, there's a great screening tool that I really love called a CAGE,
Mm-hmm.
and it stands for cut down, annoyed, guilty, and eye opener. So it's the four questions about, have you tried to cut down before and you can't?
Okay.
Is anyone in your life annoyed with you about your substance use disorder?
Okay.
Do you feel guilty about how much alcohol you drink or how much, um,
Right.
methamphetamine you use? Do you feel guilty about it? And do you have to have an eye opener? So when you wake up in the morning, do you have to have like a small drink of alcohol to just get going in the day or whatever substance? And that
Those
cage
are
screener,
good.
it's free. It's very accurate. It's a great way to just open up a conversation
Mm-hmm.
because we cannot just look at people and tell. I know people who have been in recovery for long periods of time who were a functional opiate use
Mm-hmm.
disorder for 10 years. They kept their job. Their family didn't know. They had
Yeah.
their ups and downs, but they hit it. And you've got to ask the questions.
I really like that because it comes across as not judgmental per
Yeah.
se. Mm-hmm.
Yeah. If you ask everybody, you're being universal.
Right.
Yeah.
You're asking them real questions, non-judgmental.
Yeah.
So that's a good way for us to kind of assess where we are when they come in. But what about diagnostic criteria for substance use
Oh,
disorder?
yeah. Diagnostic criteria gets much trickier. And it's certainly nothing that like a family practice can't handle. I mean,
Mm-hmm.
it's not, that's addiction medicine. You can figure this out, but it's nice to have phone a friend in those scenarios. Somebody who specializes in substance use disorder is a great buddy to have. So you can call them and say, hey, how do we do this? Because
Mm-hmm.
we use a DSM-5 criteria to diagnose. And it's a whole list of criteria that has to do with like risky use, social impairment, let me see, impaired control, and pharmacological criteria. Okay. And then there's all a bunch of different factors. And if you have at least two of those, then you have a mild disorder. And then, you go up to moderate or severe use disorder based on how many of that criteria. It's very straightforward. I'm not going to read it because it's easy to look up online, but it's
Yeah.
definitely, those give you a great idea. And it's interesting sometimes to people when you go through that and they're like, no, I'm okay. I'm not an alcoholic. I mean, I drink, but it's like, I'm
Mm-hmm.
just chill after work. And then when you go through that list and they're like, okay, so you have a moderate alcohol use disorder. Oh, wait a minute, this is starting to get away from me.
Hmm.
And so that really is a way to really narrow in. When you identify there's an issue on the CAGE screening, then doing that DSM-5 criteria is a really nice way to narrow down what are we really talking about here?
Right. It seems like it could be really eye-opening for the patient as well to be like, whoa, I didn't realize that is where I had gotten to today.
Yes. Yes.
And so
Because
we
before it
know,
gets out of control, you think it's under control,
yes, very
you know?
true. You don't
So,
realize it sometimes until it's in your face and you
right.
see it. And hopefully you see it before you have to deal with the consequences, the mental,
Right.
the physical, the emotional.
I mean, it can be
Um,
complete destruction of a person's life and
yes.
literally death. So
Hmm.
it's a big, impact early is definitely easier than coming in when things have really escalated.
Absolutely. Well, that wraps us up for this episode to help us really understand substance use disorder. To our listeners, we are so glad you have joined us for this series. Brooke will be back for episode 2 to give us more insight into the most current evidence-based treatment approaches and best practices for really managing substance use disorders.
Thank you.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.